So I had a new patient this week who wanted me to take over his PrEP prescription. PrEP is a medication also called pre-exposure prophylaxis that is intended to prevent HIV infection in people who are at higher risk of contracting it. The reason this patient was transitioning into my care is because his previous provider was uncomfortable prescribing this medication as well as managing his STI screening, which was required for prescribing the medication. And also in people who are at higher risk of HIV, they're also at higher risk of other STIs, so they need to be monitored regularly. I had two big takeaways from my conversation with this nice man. The first one is that if you ever are in a situation with a healthcare provider where you feel like they're not comfortable or willing to manage certain conditions or certain risks or behaviors, then find another one. You should feel that you have a therapeutic relationship with your provider, whether that's a primary care doctor or specialist. Seek out another one if you don't feel like your needs are being met or you're not being heard. The other takeaway was that it was fantastic that this patient was already being so proactive about mitigating his personal risks of contracting HIV and other STIs. And I would also compel you to do the same. We all have certain things that we are at increased risk for. So it's really important to do an assessment with your provider to talk about what you are at increased risk for. Could be based on behaviors, lifestyle, or could be due to things like genetics, family history. And then figure out which of those risks can be mitigated or managed. So that could be through like a medication, like PrEP, could be things like wearing a seatbelt when you drive or wearing a helmet when you're biking. Could also be things like putting DEET on your body when you're out in the woods and exposed to ticks. Different precautions that we can take that can reduce our risk of contracting illnesses. And then things that we cannot reduce our risk for. So things like genetically inherited conditions or cancers, how do we screen for those then? How do we catch them before they become more of a serious problem? So this is where having that therapeutic relationship is so important, and having a detailed discussion about your personal history, your personal risks, and how you can manage those properly is so important.